I was able to listen to Hooman's presentation the other day to the Government Affairs Committee here at the Chamber, which I also chair. And it was really interesting to hear about what he's doing and how relevant it is to today's world, and what, we've been talking already about the pandemic and the vaccine and how it's affecting our lives. So I think this is very relevant to our committee, especially because it's a technology tool that helps employers, that helps businesses right now during this time. And isn't that our mission, to educate chamber members on technology tools that help them help serve their businesses? That was our shortened mission statement that we spent a year, I think, under Alex's leadership, whittling down. So this is absolutely the right kind of presentation that we were hoping to have. So I will give the floor to Hooman. Thank you so much for being here. We look forward to hearing your comments.
Perfect, thank you. I appreciate you guys giving me the time to speak. I'm gonna share some slides, but I would like this to be kind of just an open conversation and ask me questions as things come up. As you mentioned, my name is Hooman. I've been in the tech industry now for over 15 years. I've worked at companies like Nokia here in San Diego doing CDMA phone development, software engineering. I worked at Apple, part of the original software development team for the iPhone back in 2006. I managed all of wireless technologies for them. So if you've ever sent a text message, Bluetooth phone call, Wi-Fi on an iPhone, iPad, that was one of my teams. Then I was at a startup. I went to a startup. We were acquired by Qualcomm. And then at Qualcomm, I was the director of advanced technologies for them, building IoT solutions for smart cities and industrial clients. So I'm familiar with the technology space. I've been in software engineering for a long time. And and I'll talk about some of the core principles of how we built PassPoint, which I don't generally do in my other presentations, but I think for you guys, it's a little bit more relevant, given the background of the committee. So just as a preface, right now, obviously we're in a very unique stage for employers. With COVID-19, there's a lot of rules that are changing, and they're changing every day. Some rules have kind of remained, like the first one, right, which is employers are required to protect employees from workplace hazards. This is something that's been around since the original OSHA days, but that includes infectious diseases. And so what employers are required to do right now in order for employees to come to work, to be safe and all that, is that they have to screen employees and visitors for symptoms before they enter the workplace. So you've seen this if you've gone to a restaurant where they generally have like a chalkboard or something in the front. They say, hey, if you have any of these symptoms, you can't come in, which is, the way that you get around the law. But at the same time, is it the safest thing that we can do for a community or for businesses to protect them going forward? And that's kind of what we'll talk a little bit more about what PassPoint does. Employers need to ensure employees that have symptoms don't return back to the workplace until their fever or symptoms are gone. And so this means that they have to be able to track all these symptoms. They have to be able to know which employee is on quarantine day 2 of 14, 6 of 14, and kind of what contacts they had. So there's a lot of tracing here that needs to happen for employers to be safe. And ultimately, Cal OSHA has been handing out violations and citations. They range from $475 to $108,000. And the average citation right now is about $24,957. So, I mean, they're doing it. They're out there, they're writing fines for people that are not following the procedures. There's 2 new laws that came into effect about a month and a half ago. So there's SB 1159, which essentially creates the presumption that an illness or death resulting from COVID has arisen out of and in the course of employment. Sorry if that's legalese, but that's what our lawyer had told us to put. So, but ultimately, it means that if there's an outbreak at a workplace, it is assumed that any other employee at that workplace that gets COVID got it from work. And it's your obligation as a business owner or employer to prove that they didn't. Meaning you have to present your plan of how you try to protect that employee. So that presumption is disputable. The second is AB 685, which says that if any of your employees get COVID within 1 business day, you must provide written notification to all employees and subcontractors that were present on the same work site. and let them know that basically they have been exposed to COVID-19. So again, this requires businesses to know who's on site, who they interacted with, and then be able to immediately respond to them and email them. And both of these laws, go ahead.
Can I?
Yeah.
Is there a? You said OSHA's out giving making employers pay fines and all. Is there a size limit? I mean, we're a small office. I've got 4 employees plus me. We're 5 of us.
So they post all their violations online, and I went and looked at them. There are smaller individual. It seems like there's individual kind of I'm trying to think of the word, franchisees that are getting hit, right? So it could be an office that's 10, 15, 20 people. A lot of it's been focused around the food services, people that are interacting with the customer every day, because I think they're really trying to focus on community prevention. But I mean, even the Santa Rosa Police Department got hit with a $35,000 fine. So I mean, everybody's getting hit. It doesn't matter if you're a police department, you're a city entity, or what. So a lot of this comes from the employees, I think right now, are reporting violations to OSHA, and then OSHA is then come back and researching that. So I guess it really comes out of who's in your office and if they're disgruntled or not. But I think that sets up the stage for employers being at risk, because if an employee says, you know what, I'm going to get these guys because they're not making me stand 6 feet apart, and I can prove it, and then all of a sudden file a request to OSHA, and then OSHA comes and looks at it. Yeah, I mean, they could absolutely come and hit anybody. So I don't know what their mandate is right now, but there's some of their fines were, like I said, $475. So they're writing everything.
Are these regulations California regulations?
These are California regulations. This is Cal OSHA. So Cal OSHA, California Department of Health, and our product. Yeah. So but CDC also has some regulations. Obviously, SB 1159 and AB 685 are California specific. And California, I will say, is probably more strict than most, right? I think California definitely, we've seen it now, is definitely taking this a little bit more seriously than other states. And I think that's reflected in the laws and regulations that we're seeing, which also makes it difficult for business owners because they are constantly changing. Yeah, Al.
I have a question. This has actually been a long-running question. I haven't been able to anybody to answer it for me from a situation that arose from a colleague of mine. They had, in the early stages of the pandemic, they had an employee who contracted COVID. Unfortunately, he did pass away from COVID-19. They were wondering about the contact period for people they had let go. So what is the company's responsibility for an employee? Let's say you fire an employee, right? 2 weeks ago or 3 weeks ago, right? And then you find out that there's potentially someone in your office who you're not even necessarily sure, they may or may have not been around that person, but if they are, what is your responsibility to be contacting terminated employees for COVID interaction? And then are you subject to the same laws about protecting your employees if this person was maybe fired 2 weeks ago? Because this particular individual, I don't know where it went, but they did at some point lawyer up, and I don't know exactly where it went from there.
So most of the language revolves. They've kind of set the 14-day mark as the limit, right? Most of the language, you have to quarantine for 14 days, isolate for 14 days. You have to wait 14 days. They now change it to 10 days, but after your symptoms are gone. So they're kind of sticking to this 2-week period, and I think partly, obviously, with COVID, we have the asymptomatic aspect of it, which makes it a little bit more difficult. But for the most part, all the language that I've kind of seen revolves around 14 days. So if a person got COVID, we generally, in our system, in our contact tracing platform, goes back 14 days and pulls all those interactions. So if somebody got let go 5 weeks ago, and they didn't contract COVID, now they can come back and say, well, I got released 5 weeks ago. I got it on the last day, and then it took a 10-day incubation period. I mean, I'm sure some lawyer can come and, find that angle. And I guess if the employer is large enough and there's enough money behind it, they probably would find the angle to go after you. But for most part, 14 days is the limit that we've seen.
Even if you've terminated that employee and whatnot.
Even if
you
you
need to go
terminate,
find
yeah.
them.
So you need to go find 14 days from when they last interacted with the business. So that's kind of the rough guideline. Because again, we're looking at, you contract it, it takes a couple days to incubate, it takes a couple days for the symptoms to show. Obviously, if you're getting to the point where you're hospital and eventually, you know, if the death is the final outcome, right, that you're progressing in the symptoms through that. So these are the kind of the rules. These are what businesses are now faced with, right? This is what businesses that have to open their doors, you know, and now we're back in purple. And like I said, every day things are changing. And so what is PassPoint, right? PassPoint is a platform that helps stop the spread of infections in your workplace. And so whether that's COVID or seasonal flu, we do that by a couple main principles, right? First, we automate the daily symptom screening process for employees and visitors. So this is a requirement that Cal OSHA has, that you have to make sure nobody has symptoms before they enter the workplace. So we do that. It takes about 10 seconds to fill out the symptom screener. The second thing we do is, because we know who's checking in on what days and we have their contact information, we now can do digital contact tracing. So to your point earlier, we can now go back 14 days and say, who did you interact with? Who was in the office? And then go back and identify and isolate those people. So a lot of the language in California's law revolves around the word outbreak. And outbreak basically means more than 4 people get COVID. And so what we try to do is we want to prevent an outbreak, because outbreak then triggers a whole new series of scrutiny for your business. And so we want to identify quickly who had you interacted with. Let's pull those people from the workforce, and then let them kind of isolate, work from home if they can, and then kind of quell that fire. The second thing PassPoint is a COVID compliance tool, right? So we help you identify those high-risk activities before they enter. This is part of what OSHA requires for your injury prevention and illness and prevention plan. And automatically we can notify those employees of potential exposure, again, because we have their email, we have their contact information. And then finally, PassPoint is fully cloud-based. We don't require any hardware. Everything is based on the web. So if your device connects to the internet and it has a web browser, it'll work. And that's something that we've made sure of, because again, I come from a background of tech, but I'm also not a believer that everybody has to download apps on their phone to use the newest thing, right? I mean, I have a Ring doorbell and I have to have an app for that and an app for this, and it just kind of, it defeats the purpose. This is where we kind of just want to say, look, everybody should be able to use this. Here's a copy of our symptom screener. On the left-hand side, that's it, right? We're not trying to trick anybody here. We're just trying to get the data that employers need, and ultimately we need to have the data that helps keep people safe. This symptom screener, we can talk about this more in depth, but we have different flows that we work through. So if an employee is considered healthy, they get one symptom screener. If they've had symptoms and they're currently in quarantine, we can give them a separate screener, right? That says, okay, now you've been on quarantine, have your symptoms gotten worse? Is your fever gone away? So that we can try to identify, can we get them back into the workplace quicker for you, right? Because some of the language says 3 days after your fever has broken, you can go back to work, right? As long as you're not using fever reducing medicines. So, we can track all of that. We ask these questions, and the bottom question is the most important. Have you answered each of the above questions truthfully and to the best of your knowledge? By self-certifying, employees are now taking the onus of answering truthfully. And employers can kind of relieve a little bit of that onus from them, saying, hey, what do you want me to do? My employees answered truthfully. They told me they didn't have symptoms. How can I be held responsible for them lying to me, right? And I think this is kind of where we're gonna hopefully help protect these, against these lawsuits. We don't know where the lawsuits are gonna end up, but ultimately they're coming in the pipeline. On the right-hand side, employees get a green or a red box, right? Green means go, red means no. And so this is just a simple way, again, to remind employees of the best practices, right? So in the green box, again, reminding them social distance, wash your hands, clean and disinfect. These are requirements by Cal OSHA to remind your employees and train your employees to do safe workplace behaviors. And then obviously, if you're staying home, don't leave the house unless you need to go to the hospital. And then and then we give the HR contact information as well, so that they have a point of contact within the business that they can reach out to should they have any questions, and then vice versa too, right? It allows the HR contact to reach out to them as well. Digital contact tracing, again, we're trying to identify and isolate those close contacts to prevent the outbreak. So we can sort employees by highest risk. We can categorize employees by location and department, because again, we realize that if an employee on the first floor has a cough, it doesn't mean the person on the fifth floor has to go home too, right? Businesses can't operate like that, where they're just constantly shutting down every time somebody has a cold. And this is where we're trying to be a little bit smarter and using artificial intelligence and some, algorithms in the cloud to kind of be a little bit better about how we manage this risk for employees and employers. And so we provide instant feedback. And I think, for those of us in the technology world, real-time data allows you to make real-time decisions. And this is what we're really going after. We're trying to get that real-time data back into the hands of the employers. So whether you're working from home or the office, our system will work. So we have a lot of clients whose HR doesn't necessarily come in the office, but they're a manufacturing workforce. And so we can have the HR team work at home. Meanwhile, the people can, the manufacturing team can come in the office. And then finally, it's an admin dashboard notification system. And again, this is something that we've seen in other online and IoT platforms. But again, we're trying to make real-time decisions and reduce that risk and liability for employers. So instant communication, instant notifications, compliance tracking, quarantine tracking, and then ultimately, if needed, on-demand audit reports, right? So again, if you do end up getting sued, or OSHA comes and says, hey, we want to do an audit of your safe workplace behavior, we can then step up and say, here's a time-stamped list of every employee that's checked in with the symptoms they've had, and the ones that had symptoms, we sent them home. So, and just to touch a little bit on the privacy and security aspect of what PassPoint is, right? So obviously, we have strict access control for employees and admins. This is required both from a general HIPAA perspective, right? You have to protect employee health data from other employees. It's also just the right thing to do from a tech perspective, right? We want to make sure there's access control for everybody. A lot of employers that we sign on board, they're using spreadsheets to do this work right now, which it's one way of doing it, but it's not HIPAA compliant. If that spreadsheet gets sent to the wrong person, employee health data is now in the open, it could be a problem. We secure all the data transfers over HTTPS. So this is similar to bank or financial institution websites. All the data is encrypted in a secure database, both at rest and on disk. And there's no GPS tracking at all from our perspective. And then we don't share your data at all either, right? So back to my background as a tech guy, I'm a firm believer of that your data is your data, and we don't sell that data, we don't share that data. We've gotten approached actually by numerous companies to do affiliate programs to sell our data to them so they can provide testing facilities and things like that, and we've opted against that. And that's, I guess it's a client by client basis if they would like that, but we're not doing that. So ultimately, how do we protect you and your business? We stop infections before they enter the workplace. We identify and isolate employees that are at risk of exposure. We improve and simplify the compliance, which protects businesses against litigation and things like that. And then finally, we provide all those audit reports and the real-time data that you need to track compliance. And so kind of with that, I'd like to open it up for questions. Obviously, we've been working with the Carlsbad Chamber of Commerce, and we do offer a free trial. And our pricing is actually quite affordable. We actually offer this for free for any business under 5 employees as a service to the community. And it's a true free offer. There are no strings attached to it. If you go above 5 employees, then you'll go into a paid tier, but under 5 employees, we offer it for free. So please, questions. I'd be happy to answer anything you guys got.
Hooman, is the contact tracing solely dependent on the candor of the employees? Is there any other safeguard that, in case you have somebody in
so if an employee says they have symptoms, the workflow that gets activated is the HR administrator needs to then reach out to the employee and confirm that their symptoms are real. If their symptoms are real and the employee didn't make a mistake, then there's a workflow to kind of make sure they get all the close contacts and everybody else they've gone to. To your point though, if the employee adamantly wants to lie through and through and say, nope, 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 there's nothing we can do. And there's, I mean, reality rise, right? I mean, how can you verify? I mean, temperature is the only thing we can actually take, which our lawyers have advised against because they say that opens up businesses to risk. Because now once you collect a data point, i.e. 98.6, 100.4, whatever, you now have a real, exactly. So now you have a whole separate thing. And if you look at our symptom screener, our lawyer's advice was always, and this is why you see this across the board in a lot of businesses as well. Do you have a fever, chills, muscle aches, or body aches, right? It's one of those. We don't know which one you got. We just know you have one of those. So again, but this is kind of how we all have to navigate this, but we don't collect and that's why we don't. But to your point, no, there's nothing we can do if an employee absolutely wants to lie. But we can protect the business that way because they say, they can then prove to say, hey, look, they certified that they were telling the truth and they lied.
It looks like Alex's hand was also up, and anybody else, feel free to also put questions in the chat box. Go ahead, Alex.
Yeah.
2 questions. How does the law relate to contractors, so people who are not employees, and people who you contract with regularly, or people who are contractors maybe in like a high-risk business, like they're working for 12 other, 15 other people, especially like construction workers. They're subcontractors, they're on multiple job sites. So how does the law extend to that? And the second thing is, there's employer liability if they don't do a job protecting their employees. What is the liability of the employee if they say, I don't have symptoms, or if they go around risking behavior, they bring it to work and they end up crashing your own business? What is their legal liability if there is any?
Sure. So as far as the employee liability, I have not seen any cases yet where employees have been have gotten sued or anything else. So I don't know where that's going to end up. I know I've seen some cases where people have intentionally coughed on others and then they've gotten kind of hit with things on that. So again, if the employee is actively lying, they had a test, it showed positive, they chose to still come into work, I think they would probably fall into the same category of somebody who is maliciously trying to infect or do harm. Again, the OSHA requirements are more for employers to provide a injury and illness prevention plan that protects their employees. And that's a little gray area. I don't know how the law is going to end up coming down on them. I think, obviously if employees want to be malicious, there's nothing we can do to stop them. But all we can do is kind of, again, protect the employer. As far as contractors and everything else, the law, the language around what they state is anybody who enters your workplace, which means that contractors, visitors, as well as customers, right? And this is why, again, they put it on a chalkboard to try to limit that. We have some customers, for instance, we have a few property management companies that are on board. We have a few private events companies who work with a bunch of, like a DJ or floral vendor who works with multiple different people. So they, every time before a job, they certify their symptoms so that everybody who at least is going on to that same, let's say a wedding or something, I guess weddings aren't happening, but whatever, whatever events happening nowadays, they all, the floral, the DJ, all those guys kind of come in and say, we've certified that we don't have any symptoms. So the law is for everybody, including subcontractors, including visitors, including, we have one customer who makes their UPS driver check in every day. You know what I mean? And I mean, it seems overboard, but the reality is a UPS driver is a good example of somebody who could be, quote unquote, super spreader, right? If he's sick or she's sick, it could all of a sudden get 100, on the box, coughing on your hand, putting on the box. Now I touch the box, you know what I mean? So that's why the employers that are kind of checking everybody, I think you'd rather be safe than sorry. I think this is one of those kind of cases. And I think this is where our kind of guidance is to a lot of our customers as well.
Yeah, so that's what I was concerned about, because there's some, people who don't adhere to any social distancing guidelines. They don't care. They don't want to wear a mask. They're out, they're one of those people that you're saying throwing a party with like 500 people. When does it become negligence that you go out? And I guess this is a particular problem for young people in some places. When you go out to a rager with 200 people, and then you get COVID, and then you come back to work and you get everybody sick. You know what I mean? Like when you
no,
don't,
100%. And
you know,
our questions do actually screen for, have you adhered to social guidelines or state guidelines, like avoiding large gatherings and things like that. But you're right, there is nothing to stop them from lying to us. And I think you're absolutely spot on. Some people don't care. Some people have decided that it is what it is, and we'll move forward. But I think our goal, right, we're talking specifically on employers who are employing people and who are at risk for OSHA to come down and hand a citation to them. And this is what we're just giving them the tool to do that. Yeah, go ahead. You're on mute.
Technology.
Yeah.
It sounds like a great program, but I'm wondering, you've made a choice not to connect, it sounds like, with the contact tracing that Apple and Google, that project that they're working on. Could you discuss that a little bit?
So Google and Apple are obviously doing their own kind of contact tracing, and obviously they have a little bit different resources to handle that at a larger scale, right? I mean, you know, their kind of goal with doing some of the encryption and handling how they can contact trace between iPhone to iPhone or Google to Google is a great way of doing it to kind of identify who in the community has it and to identify and isolate those people. Our goal is more to work with businesses and provide them with the guidance to protect not only their employees, but protect their business from litigation, right? Apple and Google's solution, you know, you can as a business owner say, okay, in my injury and illness protection plan, I'm going to go ahead and say that I'm going to use the Google and Apple. That's how I'm going to protect my employees. But then you have to require every employee have an iPhone or an Android. You have to require every employee to use that, which again, you know, employees may or may not want to, right? Back to Alex's, I think, point earlier, some people don't want to do that. And some employees may say, no, I'm not doing this. We've had very little pushback from our side. I think we generally kind of hover around 93% compliance rate with our businesses. And yes, the Google and Apple solution is out there, and it solves it for, I think, at a community level. What we're trying to do is tackle this at a business level. Small businesses specifically, you know, single person operations, they just don't have the resources to have a large HR team and a lawyer team and all these people that kind of sit there, and they're just trying to stay alive, right? They're just trying to open their doors and make rent, right? And I think we're trying to help those people. My background, my father was a small business owner as well. And so I've always kind of seen that struggle of small business owners where you're just trying to get to the next day. And unfortunately, one lawsuit, you know, one OSHA violation, even if it's $1,000, could be for some businesses, especially nowadays, right? It could definitely be the nail in the coffin that just kind of puts them over the edge. So that's what we're trying to do. Yeah.
I'm just going to unmute myself. Hooman, thanks for being here. This is great. I sort of get it. I actually got 2 days ago, I got a link. It appeared to come from actually Google and Apple, but it's from for an app called COVID Trace. And this was put out by Nevada, actually, health department. And I get totally that you're focused on businesses, which I really, really love. Is your service available California wide?
Absolutely. We work with Chamber of Commerce all the way. We work with up in Northern California, okay. Bay Area, East County, El Centro area. We work with a bunch of different chambers all over. So yes. Yeah,
I work with, do some work with Kelly Bagla. She's an attorney. She's actually the queen of business law. And on her website, golegalyourself.com, she actually put up a get your COVID-19 liability release waiver, which kind of begged the question, kind of alongside your business, do you actually do some consulting as well? Do you have somebody could talk to there?
Do I do consulting myself?
Well, do you have somebody in your business, or do you have an associate that, you know, because in many instances, people may have a lot of questions that go a little bit deeper. Like, do you have an attorney on staff that people can talk with?
We don't have it on staff. We have HR and legal consultants that we work with.
Okay.
They're clients of ours as well. But we work with them, and we refer any kind of questions like that to them.
Okay.
But I'd be more than happy always to work with more people in the field. I always like to educate myself about this stuff as well, because I get the questions as well. So I'd like to be knowledgeable myself, as well as, when we're developing the software and kind of adding new features, it's always good to know.
Yeah, you might want to run by golegalyourself.com and contact Kelly.
Sure. I'll reach out to her. I'll let her know that you sent me.
So once again, thank you.
Thank you.
All right, any other questions? No, I don't see any hands. Thank you very much, Hooman, for being here, for sharing, and for the work that you do. It's really important. So